I wanted to ask you to juxtapose the reality that you're seeing in the hospitals with these case numbers and with the child case numbers increasing against what we're seeing in school boards. Just last night, Pocatello decided to continue with an optional mask policy. Coeur d'Alene has dropped the idea of revisiting the issue after having a demonstration outside a board meeting last week. Can you juxtapose those two realities, what you're seeing as opposed to what's happening in the at the school board level?
Sure, I'm happy to take a crack at it. I've spent a lot of time in the last year working with a variety of school boards in various capacities. And I will say, I'm not coming up with any nice words to describe the way that the school boards have responded to this problem, because they just don't seem to understand the importance of masks in public settings. Masks to me are a rather trivial thing to wear in the course of my day as an emergency doctor. And they've been shown as recently as last Friday in materials from the CDC to change the prevalence of COVID in a school by at least 1/3. In other words, you are 3 times more likely to have outbreaks in schools that don't wear masks. It's actually 3.5, but that's a hard number. The challenge is that I think we have, because of inactivity from our president and our governor, we have left the public health decisions up to school boards, which they really have no interest in doing. Some of them have engaged in these discussions and have sort of realized the level of importance that these masks are in preventing the spread of illness, and they've embraced it. Some of them have just chosen, perhaps out of self-preservation from the angry mobs at their meetings, to just ignore the question. And it's unfortunate that the school boards are sort of the only place where this public health issue is being debated, because either national, statewide, or city officials have chosen not to engage. It's an unfortunate burden on the school boards. And to a large degree, it feels like there are two realities. The reality that I experience in the hospital with an overwhelming number of patients, and the reality that I see in the community where few people are masking. So it's not just the school boards, it's many of the members of the public who are simply delusional about how serious this problem is.
Yeah, this is David Peterman. I'm going to tag along with Kenny here on a couple of items. First of all, what we haven't talked about, which is what we're seeing more of in the outpatient, is the impact of coronavirus, particularly long haul in children. I can give you 2 or 3 examples. One is an adolescent who now has a pacemaker, completely healthy. And will he need the pacemaker for the rest of his life? I don't know the answer to that. I have other patients in which were superb athletes in all kinds of sports. And one still is not back to normal. Another one took 4 or 5 months to recover. So the impacts of COVID, as we've talked about mental health, and now we're seeing long haul in children, which is not totally explainable. It has an enormous impact. I also sometimes, together with Kenny, have been working with school boards and county commissioners. I think I've earned the ability to say some of what I've seen from school boards, from my perspective, can only be referred to as shameful. At some point, we need to think beyond ourselves and our community, and in particular our children. And when you think of children getting COVID and spreading it to someone who's immunocompromised or older, that's when you begin to just shake your head. And so I couldn't agree with Kenny more strongly that it is extremely frustrating to see what some of the school boards have done. And at some point, you have to simply say, this isn't right. And along with that, you have to simply say, no, that information is not correct. Vaccines work and are incredibly safe. Masks work and have no negative impacts on children or their learning.